Shuffle here on papers on podiums, but thanks for being here. I'm Chris Reykdal, Superintendent of Public Instruction, Reykdal. Welcome to the old Capitol building. We want to make sure we cover some really, I think, fantastic information today. I want to make sure we get folks up to speed on the vaccination results following Governor Inslee's executive order to ensure that all of our school employees in the state of Washington are vaccinated. We've got some really powerful and impactful data around that. Definitely want to talk about some of the impacts that schools are going through right now, kind of get up to speed. We haven't been with each other for a little while. Open it up for some questions at the end and make sure you feel comfortable, really just anything and all thing public ed, K-12. Again, there's a lot that's happened in the last few months, and I think you probably have some questions or at least some reactions from me, so we'll treat it as something relatively wide open at the end here. Very good news. When Governor Inslee asked state employees to really step up and vaccinate as genuine ambassadors to the public good, it did not take us long to consider the fact that we ought to have school employees be a part of that. I know they were thinking about it. We were up against the start of school, so by mid-August we were certainly thinking very quickly about whether or not his statewide order should apply to all school employees. Very quickly the governor took that action. By August 18th, I believe, we had announced a vaccine requirement for all school employees. I'm very pleased to report that nearly 90% of all school employees are fully vaccinated. There are certainly others that are in process, but not a ton, less than 1%. We had a pretty hard deadline, and folks really stepped up to that challenge. This is a little over 90% for those closest to kids in classrooms, about 88% or so for those in our buildings not assigned to classrooms. So you think of those as cafeteria employees and administrators and other folks in our buildings, and about 87% for the rest of our employees in the districts. These are our bus garages, our maintenance facilities, our central district offices, and others. So again, combined just under 90%. Let me just pause and say thank you to educators. What we are seeing is stunning, because in every single county in the state of Washington, our educators exceeded the overall vaccinated population in that county, sometimes by twice as much. We have counties at 40 and 45% vaccinated, but their school employees vaccinated at 80, 85, 90% plus. We have said before, we were vaccinated, and we will say it again here, schools are quite frankly the safest place for kids to be. The adults have stepped up and led in their communities. They've demonstrated through example their commitment to the safety of each other and themselves and their students and their communities. And their students are there, obviously, with smiles back on and lots of great energy. They're wearing face coverings. We have our hand hygiene protocols, our distancing protocols. There is a lot that is positive out there, and it's really having, I think, a great impact on students getting that sense of return. It's not like it's been in the past. It's not quote unquote normal and won't be maybe ever, but it's pretty exciting. I have to be very candid with you all, though. It is a massive strain on the system right now. Getting to this place in what I have described as perhaps the hardest school year we would ever have expected, to return 1.1 million students to in-person learning, to assess their social and emotional impacts of their time away, to assess their academic standing and what we have to do to ensure that they're on track to meet their goals. That was going to be tough enough. In a time where we were coming back with the political energy of face coverings and everything else, that was going to be the toughest thing I think any school system has ever faced in our state. But what we've quite frankly become is the state's public health deployment model. And we have to have some responsibility in that. We have incredible partners at State Department of Health. We have local health officials who do not have the resources to do what is asked of schools right now, which is a massive program of contact tracing to the tune of thousands and thousands and thousands of families every single day being called about potential exposures or actual exposures. The result, of course, is we are quarantining a lot of kids. We think at any given time, we would typically see 8 or 9% absenteeism rates in our state, BC as I call it, before COVID. Now we're at about 14% or so. That's 50,000 more students every day at home. And we believe that substantially those students are healthy and safe. This is out of an abundance of caution, but the disruption to learning and the impact on teachers to make up lesson plans, the strain on the system in other ways is immense. So we are definitely looking for some relief when it comes to that possibility, and I'll share a little bit more about that. I keep using the word unsustainable because that's what I'm hearing from the field. Hear this positive impact of vaccinations. 12 to 18-year-olds vaccinating now at 65, 70%. We expect 5 to 11-year-olds to get this opportunity soon. Our educators stepping up. We've kept our cases low. In fact, we said from the beginning we'd come in after the summer. 1 million plus kids running around all summer, many of them unmasked, would come into our schools during Delta. We would see an increase, and then we would quickly be a contribution to decreasing those curves, because that's the place where kids would be 6, 7, 8 hours a day wearing face coverings with the strictest health protocols in the country, and that's exactly what we've seen. And so we would expect some relief on that front, and are encouraging both DOH and the governor to take further considerations on how we can focus on safety in the highest risk places, unmasked students who need to eat a meal or something like that. I'm going to throw out a possibility. We're looking now at this point for thresholds. We've heard from our school districts pretty consistently. Give us a benchmark. What are we shooting for here as we begin to roll back some of the other opportunities? Again, focusing on safety, but what are the highest value safety measures that keep more of those 50,000 plus students in school and fewer of them out for 7, 10, 14 days? Department of Health is working really hard on this. They've already communicated that they're going to try to get some relief on how much time students are out when they are quarantined. We'd like to think of, consider things like an 80% threshold. If we can get our school buildings to a combination of 80% vaccinated staff and students combined, we'd like to see some relief from those things. We think that's the kind of motivation that will both help get people vaccinated and obviously give a little hope out there. So to all of our building principals, to our nurses, to those who are on the front lines of this public health epidemic as they serve in schools, thank you. It is just unbearable in some places. It's really, really challenging, but there's this sense of hope because they have kids with them. They're excited again, and the learning is happening, and students are in athletics, and they're in dance, and they're in music, and there's just so much that's positive. But we want to keep building that momentum, and we would expect folks to continue to work with us to figure that out. That said, this school year, like last year, we're down about 3.5% in enrollments. That's going to be a $400 or $500 million impact, depending on how you calculate that. Our legislature assumed we would bounce back this year in enrollments and budgeted as such. It looks like, particularly in early grades, those families maybe who found a different option last year are sticking with that option. A lot of homeschool is what we assume is happening, and we really respect those families for that decision. What we do not want to see is our schools at a time of a massive labor shortage, a very difficult time hiring folks in, and going through the double duty of returning to in-person learning while they're deploying these public health protocols. This is not a time to reduce more staff. And that's the effect if we can't get the legislature to say, hey, we assumed you would have these resources, but we're going to start pulling them back because your enrollments aren't where we thought they'd be. We are going to ask the governor and the legislature to keep us whole, maintain our appropriation that they expected, and while we still have 3.5% of our students and other options, you don't get to reduce your budget that way. When the 30th student in a math class of 31 decides to go home and take another option, you don't get to reduce an educator or change your cost model. You still need that amazing educator there for the 30 kids who are still there. So our districts are in some financial jeopardy in some places due to enrollments, and we expect to continue this dialogue with the governor and the legislature to try to make them whole. Lastly, we're going to pursue a very large request for nurses. It's always tough to get nurses in the United States. It's tough in the state of Washington. There's a lot of competition for that talent. We think this is a big moment that's going to last, where we need to bring health officials into our schools. Our prototypical school model is woefully inadequate for nurses, desperately low in elementary, middle schools in particular, but all the grade bands. Our request is somewhere in the tune of $200 million a biennium to try to build a permanent support system for schools to budget for nurses. We know it'll be a challenge in the beginning to get more of them, but I think there's a lot of acute care nurses in critical facilities that are pretty burnt out as well, and in the years to come, we think maybe they want to get close to students and help us kind of build something more comprehensive than just responding to a health crisis. Schools are where you can really build good health habits. So it's a big initiative of ours, and wanted to share with you that you can expect a $400 to $500 million request from us to hold harmless districts through this, and a $200 million biennium request on nurses. Other than that, again, I'm just going to close with a massive thank you to our school districts across the state. Rural, urban, east and west, north and south. There's certainly some differences in vaccination rates, and you'll see those as we release the comprehensive numbers tomorrow. But a 90% number at this point is fantastic. The fact that every single county has their school employees leading well in excess of their overall vaccination rates just says everything about educators. They love their kids, they love their community, they love their profession, even when it's brutally difficult, and they've stepped up and led. So I challenge all Washingtonians, if you're still on the bubble about vaccination, this is how we keep schools open. The more we vaccinate at the community level, the less cases we have in schools, the more we can shrink down all of that mitigation work, keep kids in schools, and obviously continue the recovery that we have. So please consider that vaccination if you haven't already. Let's make sure we get to some questions again. Maybe we'll focus the early ones here on the specific data and questions related to vaccine in schools, but you may have questions about other things related, so we'll go ahead and hit those now. Katie, I'll let you kind of broker the questions here.
We have a few questions from folks joining over Zoom. Does anybody in the room have a question first?
On the numbers, you mentioned this 80% threshold, staff and students. Do you know where we are today, staff and students, and would you look at some sort of a mandate for students to get that number to that level that perhaps relieve the stress?
Let's take them in two cases here. The first, do we know those numbers? We don't know those numbers in detail because we obviously aren't collecting student vaccine data, but the Department of Health has a very good sense by age group. We get to look at large age groups. Our high school systems in lots of parts of the states would be awfully close right now. Between their 90% plus staff vaccination, we've got some areas we believe where the school age population in the middle and high school level is approaching 70–80%. I think the statewide number though is probably high 60s or mid 70s. We've got other parts that wouldn't be very close at all to that number. So, but that's the kind of thing where we want the health officials to be expert in that and tell us what are you looking to do here? If we could get to 80% vaccination and undoubtedly some natural immunity that's occurring out there, you can start to imagine that when you walk in a school building between students and staff, maybe you'd be at 90+%. At some point, we've got to start thinking about when can we then put more of those resources into learning recovery, social emotional supports, and a lot less time in the mechanics of trying to identify COVID cases. To the question of mandates for students, I do not think that would be appropriate right now. I've said that very clearly, and I'll say it again. There's a different relationship between an employee and an employer, and there's a difference when you're getting paid by the taxpayers to step up and lead in your community, and our educators did that. And I did not hesitate in August to suggest to the governor he ought to apply the statewide vaccine requirement of state employees to our school employees. Students are very different. Parents are going to think very differently about that. We see the vaccine rates shrink as we go through the age cohorts, 80 and plus, the highest 65 and older, and then as you kind of work through it. So we're, 5–10 points behind the state average right now with high school students, and we would expect the vaccine available to 5 to 11-year-olds to be even lower initially. I think it needs to go through the full federal process, so not just under emergency authorization, but full authorization from the FDA, then a CDC panel, then a recommendation to the states, and then our State Board of Health should expeditiously look at this, but go through that process. So it's public health officials, virologists, doctors who are ultimately making the recommendation. I suspect next school year we could be talking about this, and I would certainly support that for next school year. I do not see anything right now that would cause me to want to truncate any of those really good public processes. We have to build trust with a lot of families when they vaccinate their children. The good news, and I'll kind of close with this, is we have lots of vaccines required right now in the state of Washington. We have a 90 to 93% adherence rate with that when students come to school, generally as first-year students, as kindergartners, but we have a lot of students who come in as 8th graders from private school or homeschool models, some who come in high school. We have very good vaccination rates, and I expect we will do the same with this one in time. But it got so politicized nationally that I think initially those numbers might be low, and I think all the confidence of public health officials and doctors making the recommendation would be wise.
There's a sizable amount that was obtained medical and religious exemption. So what accommodations are being made for that specific group to keep not only themselves safe, but the students safe?
Yeah, we're 9 or 10% religious accommodations statewide. It varies by districts. We have some districts with virtually none of those and some with quite a bit more. That is a local decision. We've said that consistently, and that's very consistent with federal law. Once you are in an accommodation process, you really are trying to make sure that you can meet the needs of the employee and the employer, which means we're seeing them essentially get to agreements where additional masking, so maybe double layer masking, more distance requirements, locations and spaces and places where the unvaccinated adult just can't be, maybe in lunchrooms because there's so much unmasked numbers of students and staff. Definitely weekly testing regimes we're hearing about all over the state. So different strategies. Most districts are deploying one or more of those strategies as part of the accommodation process. But there's a part of this where you folks are going to have to talk to individual districts and say, what was your standard protocol? We used a combination of those here at OSPI, and I should say for the record that the offices that operate in this building, mostly OSPI, but the State Board of Ed and the Public Educator Standards Board, PESB, we vaccinated about a 96.5% rate.
And there's also just a few hundred that didn't get the exemption or the vaccine. At a time of staffing shortages, what message do you have for that group?
Yeah, the question is really for those who didn't take the vaccine and did not seek an exemption. We think that's about 470 folks, maybe 500 folks around the state, 0.3% or something like that of our total staff population. You know, we hate to see those folks go. These are folks who are clearly committed to education. That's how they got into this, but they made a tough choice for themselves, and I want to respect that. I think people had speculation it would be this massive number. We always said these are educators and you don't know them. They're going to step up for their communities, and they did in huge ways, so that's great. It is tough. We came into the year with busing shortages and other shortages. It's always tough to see folks go. I hope they'll reconsider. They certainly can go vaccinate or seek a different option and perhaps come back in. And I think some will actually do that as they continue to get more comfortable with the science. So that's one thing. The other thing, though, is the message I said. For the legislature and the governor, this is not a time to be cutting budgets. We are out there trying to pay overtime. We are trying to bring retirees back. Even before the vaccine requirement, we had these challenges, and we expect those to continue for a while. To all of you out there who are thinking, I would have loved to work in schools, you don't need to be a certificated teacher to work in schools. I will tell you that. We do need certificated teachers and substitutes. In fact, we've hit a record number of emergency certifications we've offered here. But there are so many jobs in a school that are needed right now. And so if you're looking to drive a bus or to work in food services or to work in maintenance or really anything else, reach out to your local school district. They need help. You're going to need to be vaccinated, but it would be pretty awesome if in all of the great reshuffle that everyone's talking about, a whole bunch of folks said, hey, I really have always thought about working in the school system. It's a very rewarding place.
We're going to take our next question from Jerry Cornfield. It'll come through on the speaker right next to you.
Great.
Thank you, Superintendent, for taking my question. I have two questions. The first one just on the data. The several local school districts I've spoken with, they've indicated they've excluded substitute teachers, custodians, bus drivers from the data. They said they weren't required to provide it. So knowing that hundreds and probably across the state, thousands of people who are in our schools or associated with our schools are not in the data, how accurate are these numbers?
Thank you, Jerry. We feel really good about them, about 155,000 head count on this, so this would capture virtually everybody. We were really clear so the districts didn't pick different categories of employees to put in different categories of their employment location. We had very specific protocols around what we call duty route codes. Every employee has a certain code, whether they're a custodian, whether they're a classroom teacher, principal, and we directed districts on where those employees have to be located. We did not ask them to report on volunteers, contracted workers. These are employees that they report through what we call the S275 report. These are employees of the district on payroll. So yeah, there's definitely some contractors, volunteers, part-time coaches who are not currently under contract, but maybe they're going to be in the winter or in the spring who may not be in these counts. But I feel really good about these volumes and about the total counts, and anything we might additionally pick up would be very marginal to the results.
And just the other question I have, and I think you kind of touched on it, but let me ask it anyway, that the mandate came out August 16th, and now we see these numbers, and it shows 16,000 16,000 unvaccinated educators, bus drivers, cafeteria workers, and others who continue to work in their jobs with students as long as they wear a KN95 mask, maybe stay a little farther away. Is that what you envisioned when you sought the mandate? Is that what you envisioned when the mandate came, that 16,000 people would still be in our schools who are unvaccinated?
Yeah, I'm not surprised by this, and I'm actually, quite frankly, encouraged. We were probably 60 or 70% at the time of this. There were lots of folks still wondering would they do this or not. The requirement absolutely kicked in a positive result for educators across the state. Again, our student vaccine rates are 90 to 93%. This is the first time in our state's history where a public employee group like this outside of healthcare has had a vaccine requirement. So to get to 90% right here, and that will continue to climb slowly. We'll hire new employees who will be vaccinated. You see there are some that are in the process. Maybe they made a late decision to get one vaccine, but it's a 2-shot regimen, so this number will keep creeping up. But yeah, I'm pleased with this. I am not surprised by it in any way. I'm grateful for what has been done here. And I think if you would have asked public health officials a year ago, if we got folks to 90% vaccination, would you feel good? And they would have been ecstatic about that. We probably wouldn't have half the restrictions in the state of Washington if everyone here were vaccinated at a 90% rate.
We're going to take another from our folks joining virtually. So we have Dory Lizzo Gilmore from Northwest Public Broadcasting.
Thank you so much for taking my question. In many school districts, including Pierce and Benton County, school resource officers are sheriff's deputies. Both Pierce and Benton County have declared they will not mandate vaccinations or ask their employees to state their status. Will school districts in those counties continue to use tax dollars to hire SROs without confirming their vaccination status like it's required for everyone else?
Yeah, great question. Thank you. We may need to do a little fact checking here, but the governor's proclamation for state employees clearly covered state employees, healthcare workers. He extended that to us in public schools. That applied to public schools, charter schools, tribal compact schools on a voluntary basis, given those sovereign governments, and some did report. I don't believe his order was a mandate for local county sheriff's departments, so we do know some are not doing this voluntarily. We've been in contact with a few districts, at least one, where we do know that somebody in the sheriff's office is a contracted SRO to the school district, a school resource officer. The contract's with the sheriff's department, not that individual. What we have communicated is you still have a responsibility to make sure your contractors who are on site in contact with students and staff need to be vaccinated or go through the exemption process, and we'll follow up to make sure that that happens. If there is an unvaccinated unexempted law enforcement officer whose regular work is in our schools, that employment relationship needs to change with our school district.
Would you give parents who are upset about the mask mandates any hope that we will get rid of the mask mandates by the end of the school year, or should we just plan on having them through June 2022?
I think you should plan on having them through June. It's one of the most powerful safety mitigations we have. Remember, when you're wearing a mask, you aren't particularly just focusing on your own protection. You are taking on the responsibility that you may be infected and may not even know it, and reducing those droplets and aerosols to other people. It is a ultimate exercise in trusting and believing and caring about your community. In a school system where maybe 70% of our high school, middle school students are vaccinated, that's a lot of kids not yet vaccinated, 30% of them. We're just getting to 5 to 11-year-old opportunity here. So I do not anticipate the mask expectation coming down this year, although, you know, obviously what the governor has consistently said, and is this is constantly being re-examined based on the data. So one of those things we keep asking Department of Health is at some point we've got to sort of bifurcate the statewide guidance with where are we having success. And again, you heard me say it earlier, if I've got a school district where the staff is 95% vaccinated and the students get to 70, 80, 90% vaccinated, I would expect them to have different opportunities than a place that continues to resist the vaccine. And that's just good public health policy, but you should plan on wearing masks the rest of the year.
The children can carry the virus, and that small age group, the elementary school kids, the FDA is still finalizing that age group. Is that a concern for teachers, or how can we mitigate that to keep the teachers safe as well?
Well, the best thing they can do is vaccinate, and they really stepped up here. So remember, our educators are now vaccinated at this 90% rate. You know, generally speaking, some variability around the state. They are still wearing face coverings as educators. They still have their own health and safety protocols. All of them, every one of them, students and staff, the guidance is still, if you're not feeling well, you need to stay home. So we've got these great protections in place. We continue to believe they're the strongest in the country. That's not a good news story for everybody, but we think from a public health standpoint, it's a good news story. So I think our educators have shown, you know, a very high confidence in what's happening out there. Although there are places where they're constantly checking in to say, hey, you know, I need to tell you that we got to step our game up, and that's all kind of nuance at the local level. But they've just clearly stepped up, and fortunately, we've got those cases coming down in all age groups, including young people. So it's working, and I feel very, very good about that.
Getting a little ahead of the game, but your focus is on getting people the initial vaccination. Teachers are now eligible for the booster. Are you encouraging them to get the booster? I don't imagine that's data that you're tracking, but a lot of teachers early on, eligible early, they're now eligible for a booster. Important to do that. Do you encourage them to do that? They're in classrooms with the K through 5 are in classrooms full of kids that are not vaccinated.
All of our staff, I mean, what's made this moment possible is all of our staff have to think about how they offer maximum protection for their students and for each other and for themselves. The booster is available for adults, school age, or school employees are in one of those, you know, sort of considered high-risk occupations for purposes of the booster, at least the first 2 that were authorized. They should go get it. I mean, if they were comfortable getting the first shot sequence or the single J&J, please go get your booster. It protects them, it protects others. We're clearly seeing breakthrough cases. And thankfully, as the science tells us, that's very different than social media, the science tells us that the booster is doing what boosters are supposed to do, which is sort of doubles down on your immune system. It doesn't mean you aren't going to get sick necessarily. It means you are much less likely to have severe impact from this, almost virtually keeping people out of the hospital and shrinking the mortality rate to, you know, to almost nothing for those who are fully vaccinated and getting the booster. So yeah, we would really encourage that for folks. I'm encouraging it for our staff. We are not going to track that short term. Wouldn't expect to unless there's a proclamation from the governor different, but we don't expect that either. So I want to be clear about that. The governor's vaccine mandate for school employees is about the initial shot sequence or the single J&J, and the proclamation does not presume that everyone has to go get a booster at this point.
As you mentioned, this year is probably the most difficult because you're getting all these students back into the classroom. Having speaking with a teacher up north, they said that they're being asked to do more, such as you know, COVID policing, which is taken away from their daily normal teaching practices, and it's asking them to be stretched even more, doing work outside the hours and catching up, and also just the demand to bring kids back up from the delay that they've had. And also the burnout rate. What's your concern in regards to that, and also the future of next year's teacher population?
Yeah, this is, people use the word heroic all the time, and I know that might feel, you know, trite to people as we keep using that word. There are parts of this dilemma where I look at certain occupations as totally heroic, and obviously those on the front lines, healthcare officials, no question. Our educators are in that space, as I said. We brought 1 million students back under the safest protocols possible. It's gone very well, but they were simultaneously teaching new cohorts of students, trying to evaluate their learning from the prior year, trying to evaluate their social emotional impacts of being isolated. And I'll be honest with you, we've got a lot of elementary teachers who say, I'm kind of reteaching kids how to go to school. If they were a kindergartner, first grader, second grader, they really haven't been in school from age 5, 6, and 7 in person in a lot of places. So it's just remarkable to watch them do that. And then they do have this responsibility to sort of make sure that kids are wearing their masks properly, which has not been an issue statewide. Our students have been incredible in stepping up, but there is more work. And when you're constantly contact tracing and sending students home on a regular basis who are otherwise healthy, that's a teacher building individualized lesson plans. The students coming back, you know, with work that has to be turned in later. They're giving them that quiz or that follow-up learning assessment when everyone else took it the day before. If you've ever taught, getting ready for a substitute and coming off a substitute teacher is sometimes the hardest part of your entire job. And our teachers are going through that right now. Many of our elementary schools, they are also on playgrounds. They are also in cafeterias as part of their duties. There's a lot of complexity. I keep using the word unsustainable because we are going to have relief, or as you have indicated, the burnout is very real. Pre-COVID, BC, before COVID, about 4,400 annual emergency certifications for substitutes. We're up to 4,800 already, a 10% increase. We expect to be over 5,000. That's on a calendar year basis. We'll kind of beat the old record here. There are a lot of people who are second guessing whether this profession is for them at this pace. I know they're committed. I know they love it. We want them here. We need help from the governor and public health to figure out exactly what we must do to focus on the highest profile health risks and let some of that other stuff go, given the performance of our health protocols to date and just the incredible way our educators stepped up on vaccine.
We've got 2 questions from folks online. The first is Dahlia Vazaz, Seattle Times.
Hi there, thanks for taking my questions. My first question is, only about 3% of state workers were granted accommodations for religious or medical exemptions, whereas school workers were granted, as you know, at a rate of about 10%. Does it concern you that districts are granting these exemptions at a higher rate on average than other state agencies? And what do you think when you see districts granting a high number of exemptions?
Yeah, thank you, Dahlia. I think there's definitely some real unique differences between our school system and state employment. State employment is largely concentrated in urban centers. We have school funding formula models that drive quite a bit more staff in rural communities, and this vaccine followed sort of a lot of the political culture out there. So I definitely expected more school employees, particularly in those vaccine hesitant areas, to mirror their communities. So that's not a surprise at all. It is a local decision. I also think there's something very powerful about how many part-time employees we have. So what's not normal or consistent with state government is our bus drivers, our cafeteria workers, those on playgrounds, coaches. We have a lot of employees who are part-time employees, and I think they make a different decision. If I'm weighing a vaccine decision in my life and I'm somebody who's vaccine hesitant, which I am not, but a lot of people are, I think you might make a different decision for a $70,000 or $80,000 or $90,000 full-time job than you do for a $1,000, hour a year job at 15 or 16 bucks an hour. I think the nature of our workforce is a huge contributor to why folks said, hey, that's something I'm either willing to walk away from in higher numbers, or I'll go seek a religious exemption. If I'm denied, I'm more comfortable walking away. We've got some work to do on that, and I think we need a partner in the legislature to recognize that if we could rebalance these calendars and we could be thinking about school as a more sustainable activity for students and staff than the intensity of 180 days, I think we would have seen a different outcome here. So not surprised by the 10%. It sure varied by parts of the state. Really pleased at the 90% vax rate, and that'll continue to climb, but not too surprised by that.
Next question is from Griffin Riley from the Columbian.
And Dahlia, we'll come back if you had another question too. So Griffin, go ahead.
Yeah, I actually wanted to follow up on a question, on Dahlia's question. Can you talk a little bit about the criteria that you communicate to districts to consider when evaluating those religious exemption cases, and how are you able to distinguish, or how are districts able to distinguish those from more personal or philosophical exemptions?
Yeah, there's a standard framework that we sent out. I suspect that was late August or early September. We can certainly follow up with you on that. It's consistent with what is in the federal guidelines today, which is definitely a presumption of the sincerity of the employee's deeply held belief. We had a series of questions that every district had as a framework. They were certainly allowed to go beyond that. If they didn't feel like it was a sincerely held belief by the employee, they could certainly go further than that. Obviously, this has been one of those interesting gray areas and challenging for folks. You could not walk in and simply say, my church doesn't believe in this, and get an exemption if your church hasn't made that publicly stated, and there are only a few around the state. So this really was about individuals describing this deeply held belief. The federal law is really clear. It doesn't have to be a long-standing belief. It doesn't have to be affiliated with a formal church organization. It can be a recently adopted belief. We didn't get into the detail of that at OSPI because the employer of record is the school district. We gave them the framework, and then they made those decisions and followed their guidance. And obviously, it did mirror quite a bit, I think, this larger sort of political culture around the vaccine. But again, I'm super pleased that even in places with 40 and 45% vaccine in their community, we saw those school employees at 70, 80, sometimes 90%.
This is for a different topic. You can answer this. We're also hearing that districts are allowing students to opt out of assessment tests. Why is that?
Our assessment this fall is something that we are offering. We negotiated with the U.S. Department of Education. These are assessments that were going to happen last spring. We thought it was wise to wait. We wanted last spring to be about bringing those students back. As you recall, we had that 30% threshold. We wanted to re-engage students in in-person learning. Didn't want to use instructional time for that. So we're in it now. We've shrunk that assessment. It's essentially done in one class period for each subject. There were a lot of waivers that came with that. So the U.S. Department of Education does not require a 95% test participation. These are not being used for statewide accountability of districts and scoring. We will have our regular assessment in the spring, albeit a little shorter, where that will count. So I suspect if you're coming back to the most difficult school year ever, and you're carrying out health protocols as a public health duty, maybe the least important thing to you right now is a standardized exam. We still want folks to take it. We think it's informative, but mostly to inform kind of where are their students and what can they do to make improvements. But we will not be disappointed by less than 95% participation. I would not be encouraging students not to take it. In fact, we've heard districts who, even though some students are hesitant, are really encouraging it because it is a pathway option. It is one thing you can do at a certain score to demonstrate one of our grad requirements, which is a pathway option. And so we see a lot of districts with high fidelity offering the exams.
One last follow-up to that. If not all the students are taking those tests, how have your teachers identified those achievement gaps?
Yeah. I'll grip the podium only gently and tell you that the last thing I would do as a teacher is use a federally mandated standardized exam to determine where my students are. It is a part of state accountability, and I think it's an important part. It is not a good tool for individual student accountability. So the cool part about teachers in our state is as they get certification, it is more than just knowing their content. They learn about assessment and learning where students are. They've got tools they used on day one, many of them over the summer as they spent federal dollars preparing for this and bringing students in. So we have local assessments in reading and math and science and other subjects that are far more responsive immediately so that teacher and student get an interaction more quickly. Those are far more effective. That's what they've been using and will use. So you know me, I'm not going to be too excited one way or the other, no matter what these fall scores look like. But for state accountability, you know, these are still important things to do.
For clarification, people who are working with, say, for instance, the football team, they're a coach on the part-time, what's their requirement? Are they required to get the vaccine, or is it dependent on the district?
Yeah, so most of those folks that they coach this fall, they are on payroll now. They are currently on payroll, and there can be some other relationships, but generally they're on payroll, and they were a part of this. They needed to either vaccinate or go ahead and get their exemption process underway, and so we saw very high fidelity too amongst coaches. What I was trying to indicate earlier is if you're scheduled to coach in the fall basketball season or the spring track season, you may not even have come to this process yet, but as you come into the system now, they're going to say to you, you need to vaccinate or go through this process. So you're going to see those vax numbers just continue to climb throughout the year. Dahlia, did you have one more? Or? No? Okay.
Nobody else online? Anybody else in the room? Dahlia does have a question.
Okay.
Thank you. I had a question about whether you know anything about the vaccination rates for private schools. I know they were also subject to the mandate.
They are, no. We don't collect data on private schools, certainly not in this realm and not in most realms. Their basic education sort of attestation goes through the State Board of Ed, and I don't think there's any process for them in this. So we do not have visibility on private schools.
Does any other state agency have that visibility? Does the governor's office collect that data, or do they not submit it at all?
I don't believe they submit it at all. We'll certainly check in with the State Board of Ed to see what plans they have, if any. Again, those attestations are kind of happening right now, and generally, when we're not in COVID times, are you offering enough high school credit science? Are you meeting the state minimum requirements? There's some basic attestations they do, and I don't suspect, given the very late recognition of this requirement in mid to late August, that any of that was put in place, but we'll check with them.
Okay, thank you.
I'll close again by saying thank you. This is a pretty big moment for Washington State. candidly, I think the rest of the country is sort of looking at us saying, you know, you were one of the first, if not the first, to have a vaccine requirement for educators. We candidly frustrated some people by not having a weekly or biweekly testing option. We just did not get the confidence from public health that that's necessarily the safest model. We've said it before, you could be tested on Monday, get your results on Tuesday, and Wednesday acquire COVID and be symptomatic almost immediately. So this was a tough bar, and our educators stepped up. They're incredible. But the system is cracking all over the place under the dual mandate of education and public health protocols, and we definitely have to get more relief on contact tracing, and we have to sustain the budgets we do have. Not seeking significant new money, trying to hang on to the money already appropriated. We'll be working with the legislature on $400 to $500 million in that space, a couple $100 million for nurses, and really try to round this thing out so that we're very sustainable for the coming years. Thanks for being here, and we'll pull these together again in the near future. Thank you.